12 in the morning. In this morning's Health Watch, back pain. It affects 8 out of 10 people at some point in their lives, and there are a lot of misconceptions about the causes and the cures. Our Dr. Jennifer Ashton is here to separate pain facts from fiction. Good morning, Jen.
Good morning, Maggie.
We're going to show some myths, some common myths about back pain, and debunk them this morning.
Hopefully.
Myth number 1, only overweight people get back pain. We know that's not true.
Totally.
Many risk factors, aren't there?
Absolutely. There are a lot of risk factors, and it can affect anyone from pregnant women, thin people, young people, old people. Really, as we said in the introduction, 80% of Americans will suffer from back pain at some point in their lives. So chances are good that if you're listening to this, you've either had the problem or you will have it in the future. And it really does not discriminate. It affects everyone.
A lot of people who go to the doctor for back pain, the doctor recommends back surgery, which has perpetuated myth number 2, that back surgery is the best medical option. When is back surgery an option, and what can you do in the meantime?
Well, first of all, we have a saying in medicine and surgery, Maggie: a good surgeon knows when to cut, and a great surgeon knows when not to. So if you develop back problem and you go to your first doctor and they say, I think you should have surgery, you should probably absolutely get a second opinion. In fact, studies have shown 90% of back pain sufferers will get better with no treatment at all within 3 months. So again, for people who have had chronic back pain, or it's worsening, it's interfering in what they're doing every day, and they've tried every other less invasive treatment, then possibly surgery is an option, but it should absolutely not be the first step.
Less invasive like what?
Well, anything from yoga to acupuncture to pain medications to muscle relaxants to finding the root cause of the problem. But again, surgery is rarely the best option right out of the gate. All
right, this one is a myth that surprised me. I didn't know if it was true. Myth number 3, stay in bed until pain goes away. I have heard that's a good thing to do.
Yeah, probably not.
No?
Again, maybe for 1 to 2 days, especially if you've suffered an acute injury. But again, the body is a machine, and it needs to work and move in order to recover, even from an injury. So when we stay in bed, we know that the muscles get weak, and that can trigger its own cascade of problems. So if you are finding that after 1 or 2 days of rest, you're getting worse and not better, absolutely you want to see a doctor. And we should also mention, Maggie, that back pain can be caused by a variety of factors. If you have pain that interferes with neurologic processes like urination, or you're having numbness or weakness down a leg, it might be something else. And again, you want to see a doctor sooner rather than later. All
right, the last myth: exercise is bad for your back. Now, I can understand why people might believe that this is true, because if they have back pain, they'll think that exercise would exacerbate it. Is that true?
Exactly, absolutely not. And again, the stronger your body and your core muscles are, the better. So there are a couple of very important things that you can do in a preventative manner, because again, the best way to treat back pain is not to get it at all. So absolutely, you want to do stretching routinely, even if that's every day. You might say, well, I only need to stretch before I work out. Not true. You want to stretch really every day, especially as we get older. It becomes more important. Wearing comfortable shoes, especially if you're on your feet for long hours during the day. Sleeping on your side is much better than sleeping on your tummy. That puts a lot more pressure on your back. And lastly, especially if you're lifting, anything from a bag of groceries to heavy things at your job, you want to lift properly, not from the back or the waist, from your knees.
I will be practicing all those things because I got a lot of back pain. Thank you, Jen.
You bet.
A lot happens early on The Early Show, weekday mornings on CBS.